Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Our topic for today is infertility with Dr. Jane Levesque. Dr. Jane Levesque is a naturopathic doctor who specializes in fertility. Her mission is to help high-achieving couples get pregnant naturally, have complication-free pregnancies, and give birth to healthy babies. Thank you so much for joining us, Dr. Levesque.
Thanks so much, Ben, for having me. I'm really excited to chat with you today.
Excellent. So what are some of the biggest obstacles that couples have when trying to conceive, especially today in 2023?
I think in 2023, the biggest obstacle is that there's so much information and it's really hard to decipher what's true and what's not. I have a lot of patients coming to me, basically just, I've already tried this. I'm taking a handful of supplements. I have no idea what to do, what's working, what's not working, and feeling like the conventional route, whether it's IVF, IUI, even, medications, letrozole, Clomid to stimulate ovulation is the only option. And so it's being able to kind of have a filter on the information and also understanding where you are in your journey. That makes it difficult for couples, because if you're just starting out your journey and you have no idea what it's going to be like, your biggest obstacle that I see for couples is that you're just overwhelmed and you're fearful of the future. And sometimes unnecessarily so. And sometimes, there is, of course, a reason to that fear or anxiety. And couples who have been struggling for a long time, it's like, I have no idea what to do. I have no idea what's working. I don't have any answers. And I'm tired of throwing things at the wall and hoping something that's going to stick.
Not to mention that fear, stress, and anxiety is a major obstacle to getting pregnant.
Absolutely. Yeah. And it's this vicious cycle where, I follow a lot of people in the infertility community where it's stop telling me to relax or going on a vacation doesn't help. And I know what they're saying, because obviously it's not, if you have endometriosis or PCOS or fibroids or other conditions, going on a vacation isn't going to fix that.
Right.
But relaxation and having a calm and soothed nervous system is absolutely part of being able to conceive.
So when you're seeing a new client for the first time and going through their history, what are some of the things that come up most commonly?
Yeah, a lot of the times, actually, like as a general thing, is people have no idea what's going on, even though they've had all the testing done. So one of the things that I've been really telling my couples and on my channels is make sure you have copies of your lab tests, and your practitioner should be going through them with you. What we're seeing now is you're getting this, labs look normal, don't like nothing that we know of. And then you're left feeling you're in this space like, okay, well, I guess I still have my painful periods. I can't get pregnant. I'm still tired. I still have brain fog, but my labs look normal. Where in reality, they've never actually even looked at their labs, and they haven't seen if there's any L's or any H's or any just abnormals, reds, because the doctor is just skimming through. And a lot of the times they'll miss information. And so I have patients who had no idea that they had adhesions on an ultrasound or even little fibroids that were present. They had no idea that their estrogen was out of range for the mark that they were in. And so there's, of course, the normal range and the optimal range. And that's kind of the initial consultation. When I first see people, it's like people just have no idea.
Explain the difference between the normal range and the optimal range.
Yeah, for sure. So like, let's take vitamin D. Everyone talks about vitamin D now. It depends if you're in the US or Canada, but the range can be, anywhere between 25 to 100 or 120.
Right.
If you're at 25, are you really at an optimal range? It's like, to me, that's a low, especially if you're trying to conceive, because now vitamin D is important for hormone production. It's important for mood, right? Our neurotransmitters, our immune system. There's actual receptors on both the egg and the sperm, vitamin D receptors. So if both male and female are going to be low on that reaction isn't going to be as strong for fertilization. So if you're telling me that, okay, I'm in the range, but you see that you're on the bottom half of the range or on the top half of the range, it's likely that you're probably low or there is an imbalance, right? Because everything in the body is about balance. Even too much of a good thing is, it's too much. And obviously not enough is it as well.
Yeah, I think in the US, the average doctor will say, and I think most of the labs say over 30 is normal. Anything more than that is a bad idea. And yet I feel for a couple trying to get pregnant that they should get their vitamin D level at least up to 50.
Yeah. And I say like 60 to 80 is a good range. And we try to do, it depend on, like I have a couple patients in California. So if you have access to the sun, you need to be going out to the sun. I live in, Calgary, Alberta, where we don't get a lot of sun for a lot of time of the year. So when we can get access to it, go for it. But when you can't, that means you need to supplement, And so, the best way to know how much you need to supplement is just by doing some testing.
Besides low vitamin D and fear and stress, what other sorts of things do you see come up in history?
For sure. So it's like for females, it's figuring out if they're ovulating and if that ovulation is good, meaning that the quality of the egg is good. Now, there's no tests that show quality of the egg, but kind of the way that I look at it is your eggs are your cells. If your cells are healthy, then chances are your eggs are also going to be healthy, because women who struggle with low quality eggs are also women who are struggling with fatigue, with digestion, anxiety, skin issues, you name it, like weight, all that jazz. So for women, I'm always looking at the FSH, LH ratio, estrogen on day 3 and testosterone on day 3 from hormonal perspective. And then like day 21, day 22, 7 days post-ovulation, ideally, you're looking at progesterone. And that's going to give us a really good idea if, number one, you are ovulating, and number two, how strong that ovulation is. And then we want to look at your electrolytes, your liver panel, your kidney panel, and then I'll go deeper into gut zoomer and all that. Usually people don't have that when they come to me. They have just the basic information. And I've had women who had their FSH well above 10 in their 20s, which is a strong indication that woman is no longer ovulating. And it's whether it's premature ovarian failure.
Maybe you can explain about LH and exactly what that indicates at what range.
Yeah, for sure. So the LH strips is something that women use to help them detect that ovulation in the halfway through the cycle, which again is something that I don't want to say I advise against, but it's not a super reliable way to tell if you're ovulating or not, because LH is a pulsatile hormone. So sometimes it comes before ovulation, sometimes it comes after. And so it can confuse women. When we're testing it through blood on day 3, we're looking for a FSH and LH ratio to be close 1-to-1. So if that LH is really high, usually it's a sign of polycystic ovarian syndrome. Now, that's not the only thing, but you need to look at that ratio. The FSH, the follicle stimulating hormone, if it's above 10 on day, let's say between day 3 and 5, it's typically a sign that the body is not ovulating or that ovulation is really sluggish. And the way that I like to describe the relationship between the FSH, if you will, is the brain. The FSH is a brain hormone. And the brain is where ovulation starts. The brain is the one that has to tell the ovaries to start growing the follicle, getting it ready to produce. If FSH is nice and low, it's like the brain has to just whisper to the ovary to say, hey, it's time to ovulate. Versus if that FSH is really high, that means now the brain is screaming. It's like a parent-child relationship. Whether you tell your kid really quietly to put on their shoes and they do it, or you have to yell at them several times and they still don't do it, then that's the relationship there. So when that FSH is high, it's a sign that the brain and the ovaries are not communicating. And so we want to address that because obviously if you're not ovulating, it's going to be very hard for you to get pregnant.
What are some of the other things you'll see on a hormone panel besides FSH and LH?
Yeah. So estrogen, if you test it on day 3, for the most part, I find women are in range. So this is testing it through blood. Now you can test estrogen through blood, through saliva, or through urine. And blood is going to be your kind of gold standard diagnostic. We'll show you exactly what's happening in the body this moment in time. Whereas I do a lot of urine analysis. I'll use the Dutch hormone panel by Precision Analytical, where we're looking at the metabolites. So how are you breaking down your hormones? And that breakdown then shows us what's happening with your progesterone, what's happening with your estrogen, what's happening DHEA, testosterone. And so I like to compare the two because we want to see what's happening in the body right now versus how is your body breaking it down. And it gives us an idea of some genetics. It also gives us an idea of how your liver is working. So I'll typically see really high estrogens, or you're favoring a bad estrogen versus a good estrogen. And a lot of symptoms come with the quote unquote bad estrogen, whether it's painful periods, heavy periods, fibroids, and even endometriosis. All those conditions are driven by an endocrine disrupting process. It's a hormonal imbalance, right?
Explain what you mean by a bad estrogen.
Yeah, so there's kind of 3 different metabolites: E1, E2, and E3. And so there's some that are more harmful and some that are better, right? So E1 is the good one, if you will. And then there's E2, that's more of the bad estrogen. And then E3 is kind of this in the middle where we see it in conditions where there's a lot of replication, if you will. So we'll see that a lot in fibroids. We'll see it really high in pregnancy because there's a lot of growth that's happening during pregnancy. And then you'll see it in fibroids, endometriosis, and in pregnancy. And then E2, usually we see it in relation to cancers, whether it's breast cancer, whether it's cervical cancer.
So you're referring to estrone as the bad one, estradiol as the good one, and estriol as
kind of this middle where sometimes it's okay to have it, but other times it's more about the ratios than it is anything else.
Right. Some doctors consider estriol a weaker estrogen and estrone a stronger estrogen.
Yeah, for sure. And like I said, it's in the body, it's all about balance, right? So if I look at, they give you the gauges, and if you're seeing someone really push towards one side, then you're kind of asking, because some of it, it's like I said, you're going to see a little bit of genetics too, right? We have certain enzymes that are upregulated, and so they're going to push certain pathways. And so you might need to eat more cruciferous vegetables just because that's what your system needs in order to function at its best. And this is where we can get into more customization and personalization, as opposed to this kind of generic advice of, yeah, absolutely, everybody should be eating vegetables and having good quality protein and clean water and all that jazz. But when that's not enough, or like when you're not getting results from that, it doesn't mean that, oh, okay, I guess this isn't for me. It's more like, well, what else is missing? And let's dig deeper, and maybe we need a little bit more of something. And maybe now we need to tweak your supplement routine and take a look at your environment a little bit deeper, because we know those are the basics. Like we can't get away from that in terms of as a human, like everybody needs to move their body. We can't not move our body and say that we're healthy, and that's the same kind of what I see with some of the basics of like the protein and eating enough protein, eating enough veggies, water, all that jazz.
Now, when it comes to hormones, one factor that I know is very common is quite a number of women who've been taking birth control and often taking birth control for years and years.
Yep.
How do you deal with
that? It's a huge problem. Yeah, it's a huge problem. I mean, one of my patients right now, she just conceived. She's at 10 weeks. She was on birth control for 20 years. And so she had because like since basically 12 years old, was put on birth control to whether it was PCOS or something. And then just one of those, like never got off it, didn't know enough about it. And so it took us almost a year to regulate her cycle to a point where instead of it being every 60 days and then 55 days and 42, and it was a lot of work. So birth control, that relationship that I talked about, the brain and the ovaries, it just shuts down that communication altogether. So now the brain and the ovaries are not talking. And if they're not talking for a year, okay, the brain can restore that relationship. And maybe it's even 5 years. It's okay. It might take some time. But if it's been a decade, if it's been 15 years, it's going to be harder and harder for those pathways to come back and to come back in a good, strong way, if you will. Then the next component with birth control is, it's a synthetic hormone. So your body has to process it, and it takes a lot of nutrients. So it depletes a bunch of nutrients from your system. And of course, like I said, it's a synthetic hormone, so it's strong. Your system has to work through that. And so we see deficiencies in B vitamins, in a lot of antioxidants that are really important for fertility, like N-acetylcysteine and CoQ10, zinc, selenium, things that are, of course, also important for the thyroid. And then there is a connection between the microbiome as well of the gut. We talk about hormones a lot, but it's like you can't balance hormones without gut function. If you have poor hormone function, guaranteed you have something in the gut, even if you, quote unquote, go to the bathroom, have a bowel movement once a day, twice a day, and you don't have any issues. I have mild bloating. I find a lot of us are disconnected and have no idea what a good bowel movement actually looks like and feels like. And so if you have imbalanced hormones, you probably have microbiome issues as well. But the connection there, Ben, is that it's a huge impact on, it wipes out a lot of the good bacteria. And so then, hey, that's going to make it really hard for the body to produce neurotransmitters like dopamine and serotonin. So then there's anxiety and depression that's associated with it. So it kind of can just spiral,
Yeah, shame on them. They should have the Bristol stool chart on their wall.
That's it. Exactly. But, in all honesty, we're not really taught. And there's a lot of I'll have a lot of women who have shame around even talking about bowel movements, because it's it's a private thing. You shouldn't talk about it. And we're holding this all the time. And so our pelvic floor is really tight. And it's, we'll look at the stool analysis, and it's there's an insane amount of overgrowth, and there's so many pathogenic bacteria there. And we think that our gut is so separate from our reproductive system. But if you look at the abdominal cavity, it's all crammed in there. Your uterine lining in your uterus is separated from your GI tract by a tiny little membrane. And all of that stuff travels back and forth. And so you might not have a bunch of yeast infections or UTIs or whatever, urinary tract infections, to have pathogenic bacteria that's all surrounding your reproductive organs, which becomes really vital for a successful pregnancy.
So how do you like to analyze the stool? What's your favorite stool test you like to run?
I've used the diagnostic solutions before, and I've, over the last couple of years, I switched to Vibrant America, and I love it. It's probably the most comprehensive. The Gut Zoomer is the most comprehensive one I've seen to date. They test up to 8 inflammatory markers, and they do all the immune system and the microbiome and the pathogens, detecting how with your pancreatic elastase, so how well you're absorbing, digesting food, short chain fatty acids. So I've really, learned to love the test, and I find it gives me so much information to just really look at the gut in depth, so we can start attacking and addressing some of the things that are going to come up. Because there's no such thing as a normal stool analysis. There's a little bit of fear, I think, from people well, I don't want to invest into lab testing because everything is always normal. And it's just yeah, it's not possible.
Well, the other thing is patients are not really, they don't understand the levels and depths of lab tests that are available. And they go to their doctor, they get a CBC and a chem screen and maybe a basic lipid profile, if they're lucky, a couple of hormone tests. And each test is put on a separate sheet of paper. So it looks like they had every test that you could possibly get. And actually, on the scale of lab tests, they had this much done.
Totally. Yeah, no, I agree. I think, and that's, the point that I made before, it's like, you want to understand what really got tested. Like, I just took on a couple a month ago and they were like, yeah, sperm analysis is fine. And I put out this freebie to be like, hey, if you're not getting pregnant, make sure you check your partner's sperm analysis. And like, these are the parameters. Turns out he didn't even have enough volume to run the test. And so they read it as, oh, it's normal, don't worry about it, versus he had to go back in and do it. And so it's like, there was this 6 months period that they had no idea that something was wrong, where in reality, there was a lot of things wrong. So infertility and fertility in general, like once, especially we as women decide we want to have children, that time is on. Like, you just feel like every month the clock is ticking. And so from the perspective of not feeling like you're wasting time, you want to understand what's going on, like both of you, because it takes two. And so hopefully whoever is listening is like, hey, collect your labs and take a look at them yourself. And if you have no idea what you're looking at, your doctor should be showing you that. That's what a good doctor does, is, hey, doctor is teacher, right? Like, I'm going to show you that these are the things that are wrong. This is how you're going to fix it. Instead of waiting for the big red diagnosis, you can do something about things, we all have something to improve on, right? Always.
And I think the health of the man gets overlooked quite a bit. And that's at least 40%, right, of the potential issue.
Huge. Oh, yeah, for sure.
It's easy for the guy to say, well, I'm fine. It's not my problem. Yeah.
Totally. And the saying that I like to say is like, men don't go to the doctor, they go to the emergency room. I think that's very, like, all my men who come on, they're like, everything's fine. And then I look at even half the stuff and we test and I'm like, oh my God, like, how are you not? Because there isn't that report card that you get every month. Males in general are not, you don't have this cyclical where we as women, if something is wrong, we will know it in the second half of the cycle. Men's cycle is daily, right? That testosterone, it's up and down, and then peters, and then up again and down. And so it takes a lot for a male to be very aware and in tune to say, hey, something is off.
And men tend to ignore their health. They fill out those health questionnaires that we have everybody fill out. And the guys will have like one or two. And you start asking them and they go, yeah, actually, I do have constipation and bloating, but it's fine. So they put 0 down. And yeah, I do have fatigue, but I put nothing down because it's okay. And once you start going into their history, there's a million things going on. They just don't.
And some of that I think is training, right? Like, I'm not sure what you experience in your practice, but like societal that, hey, I have to be the strong, tough guy and I can't show weakness, that we really kind of need to start breaking that barrier. Because I know for me, it was a big, with my husband, when we first met, it's like, I'm a naturopath. He was into fitness, but it's like, there's a big discrepancy in terms of what you do when you're working out at a gym versus a naturopath. And I was very straightforward of like, this is really important to me. Like, I want to grow with someone who is also going to want to be healthy and grow a healthy family together. And this was before we got married, because it's like, hey, if we're not on the same page now, it's going to be very hard to be on the same page down the road,
Your husband's into fitness?
Yeah, we owned a CrossFit gym for 5 years, and we have been in the fitness industry. I was a personal trainer for a while, and then, kind of looked into nutrition and just deeper layers of like, hey, I had IBS and weight loss resistance after you gain the freshman 15. For me, it was more like freshman 25. And that's like, hey, I'm exercising, I'm eating well, and my weight is not coming off. So something else is going on here. And, as a trainer, I used to see women and men who would work so hard and they would eat so well and like nothing would happen. And it was just like, okay, there's more to it than just nutrition and exercise. I think it's an important piece, but, I call kind of my approach the pizza approach, where like nutrition and exercise is important, but now you have to look at detoxing, you have to look at environmental toxins, you have to look at labs, you have to look at supplements, you have to look at mental and emotional health, you have to look at community and who's supporting you and stress. So when you look at just exercise and nutrition, now you're like, oh, that's just two pieces of the pie. So if you're doing that and you're not seeing results, just know that it's not that you don't need to do those pieces. You absolutely still do, but there's like at least 6 other pieces that are missing,
Yeah, my path to functional medicine and health and chiropractic came initially via fitness. And I did the whole bodybuilding thing back in the 80s and
for sure, yeah.
Learned how to manipulate body fat and everything else.
Yep. Yeah, it's funny. We've come full circle. Like I started in the bodybuilding and then we got into CrossFit and then we kind of went back a little bit into bodybuilding. Now we're kind of getting into running, and it's just like exploring different ways of moving your body and what your body is capable of. But the theme doesn't change. It's what I was saying at the beginning. It's like, we have to move your body. That's not an option not to.
Right.
That's just like the machinery and how it works and what it needs. So how can you make it fun, for yourself?
Good. Yeah.
Yeah.
So you mentioned nutrient levels and looking for micronutrient deficiencies. What tests do you like to run? My guess is you like the Vibrant micronutrient test.
Yeah, I do. I like to run at the same lab if I can, because for the most part, it makes it easier for myself, but obviously for my patients as well, because they're getting one package versus 17 different ones.
Right.
And they run, the red blood cell and the white blood cell. So the red blood cells kind of show us what's happening now, versus the white blood cells shows us what deficiency has been around for longer. So usually minimum 3 months, but sometimes we can see that 6 to 9 month mark if it's been, truly deficient for a long time. So I like that test. And it gives, of course, lots of different antioxidants and vitamins and minerals and amino acids and fatty acids. And fatty acids are really important, like the omega-3, omega-6 ratios, because there's a lot of different diets out there now. And so people have kind of thrown themselves into different diets, whether it's keto or metabolic diet or like you name it. There's just so many different stuff that people are trying, where I like to see, hey, how's the body doing? And then we feed it what it needs, because if your diet is missing something and you need to supplement, like we all need to supplement now, but you know what I mean? It's like if it's really deficient
right.
because you're not getting in your diet, then it's probably not a good diet for you.
Right. Better to test, don't guess, rather than just pick a diet based on philosophy.
Yeah. And, with that advice, I say it depends on where you are. If you're just starting out, you can probably get away with just some general advice of I need to drink more water. I need to start moving my body. But if you've been at this for a while and you feel like the amount of effort you're putting into your health doesn't match the output, meaning I'm putting in all this effort and my cycles are still irregular and I'm still can't lose weight, then there's a missing piece. And so those general approaches are not going to work for you anymore because you've already done that. And so that's kind of, if I can bridge the gap for some people to say, it just means I'm missing and I'm ready for the deeper level versus just generalities of eat better, exercise, sleep more, all that jazz that we all need to do anyways.
What are some of the most common micronutrient deficiencies you'll see? Let's start with women who are having issues with fertility.
For sure. So, vitamin D is pretty up there. Selenium and zinc so thyroid. Sometimes I see things like the vitamin A and vitamin E. So those really strong antioxidants. Surprisingly enough, I don't see a lot of CoQ10. Because so many women will supplement with CoQ10 because they've seen the research and the studies. And so one of the things I always say is you might need CoQ10, but you might not. And so if your CoQ10 levels are good, but you're taking it, that's the whole, I tried this and it didn't work. So a lot of the thyroid nutrients, like I said, the selenium, zinc, vitamin A, vitamin E, even sometimes vitamin C, and that usually depends on what's going on with the immune system. Vitamin K, if there's a lot of digestive stuff, K1 and K2, because we produce a lot of that in the gut. So I'll see that deficiency. So usually I never just run one test, right? Not one test is going to give us all the information. So it's being able to connect those dots. And then the omega-3 and omega-6, the omega-6s are usually high and the omega-3s are low. So it makes that ratio way off. And so you're more inflamed, and that comes out in different ways for women, whether it's painful periods, whether it's heavy period, maybe it's skin issues, like it's inflammation. So it shows up in different ways for people.
So let's talk about fish oil or omega-3 supplementation. For a woman who tests is low, what would be a typical sort of recommendation, let's say for 30-pound woman?
Yeah. So I actually first look at the diet, because sometimes it's not so much that the omega-3s are really low, it's that the omega-6s are really high and that ratio is thrown off. And so omega-6s are going to come from seed oils, right? Those are the quote unquote, and it's not that we don't need omega-6s, it's just that we can't have too much. And there is even omega-6s in eggs, right? So it's not that, oh my God, I need to stop eating eggs. It's understanding the ratio and how much balance. So
yeah, there's omega-6s in nuts and seeds.
Exactly. Yeah. And so it's not that we don't need it. It's that how much, where's it coming from? And so, the big popular trends of like the oat milk and the almond milk, if you look at the ingredients, and I jumped on the train, was like, oh my God, amazing, another milk alternative. But if you look at oat milk, it's seed oils and it's really high in sugar, right? Because it's oats, like oats are sweet. And so it's probably one of the worst combinations that we can throw into our system, with this really high fat and high bad fat, high seed oil, and high sugar. And then you look at conventionally grown meat and even chicken, like chicken breast has probably the lowest nutrition profile. So all my fitness geeks out there who love chicken because it has the best macronutrients on there, it's so high protein, no fat, no carbs, it has the worst nutritional profile. And it depends on what those chickens were eating. So if they're eating a lot of seeds, and the same with beef, it's like, why grass-fed? Well, grass-fed beef becomes high in omega-3s. But conventionally grown corn, grain-fed beef is now high in omega-6s. So it's switching the type of food that you eat will actually make this big difference. Because now let's talk about fish. We have to look at, it's really hard right now to source high quality fish without any contaminants of heavy metals, plastics, BPAs and phthalates and all the stuff that is literally the fish is absorbing. And that includes getting really high quality fish oil. So I would make sure that company is reputable and they do the testing, and you probably are still getting some exposure, but it's very minimal and the pros are going to outweigh the cons. So I kind of go through the food first to make sure that, hey, what's happening with our diet? Because again, it's, I've been eating chicken breast exclusively for however long. I don't eat red meat because I thought it's not whether it's a macronutrient thing or I can't digest it because I don't have enough, or whether it's I decided to be a vegetarian or a vegan, like we need to eat. And then, I'm having all these milk alternatives that turns out have really high seed oils, or even like crackers and popcorn, like things that are healthy. It's like there's still a lot of seed oils in there. And so it's everything in moderation, but turns out you're not having it in moderation. Turns out that's, the majority of your diet. And then we look into high quality supplementation, and I'll do anywhere like 3 grams to 6 grams of total omegas. The EPAs we're looking at probably a gram a day is what I'd like to get in. So you have to read your labels, because it's like a high potency one. It's usually, 1 teaspoon twice a day. Versus if you're just getting something on the shelf, it's like you only need to take like 12 caps to get that.
Yeah, especially if you're using a what's that one source of omega-3s from the little fish? What's it called? I drew a blank. Anyway,
no, I was like aqua something, but I'm not sure if that's the same one. That
anyway, what about adding additional DHA, since DHA is so important for nervous system?
Usually I do both. Usually it's a combination.
Typical EPA, DHA, and then add additional DHA.
Yep.
Krill oil I was talking about. Most krill oil capsules have maybe like 100 milligrams of EPA and DHA.
Yeah, that's right. Yeah. So, I mean, it's really understanding because the micronutrient testing, again, will show you the EPA and DHA. And, once my patients are pregnant, especially in that second trimester, I'll put them on a much higher dose of DHA. But usually the fish oils, they're not just one, right, omega, they have the ratio. And so it's just playing around with the ratio. So instead of it being 2-to-1 of EPA to DHA, that ratio is flipped. And so it really will depend on your needs and where you are in the process. Like I said, in pregnancy, I'll hike that up even more. And that's the kind of with supplements, when you're just exploring it yourself and doing it yourself, you're going to stick on the lower side of the recommendation or whatever the recommendation is. But it's like half the times that's maybe a quarter or maybe half the dose of what you need. So you're like, oh, I didn't notice the effect. It's like, well, yeah, like what if you got prescribed a medication and you only took half the dose? Unlikely you would feel that same effect, right? So it's in terms of
not getting enough EPA and DHA, the same thing goes for some of these prenatals. Sometimes they're prescribed and they contain fish oil in it, and patients feel like, well, this has everything I need. But if you're taking one tablet or capsule, the amount of EPA and DHA you can get in there is minuscule.
Well, in sticking fish oil with everything else, the way that fish oil is stored should be different than the rest of your vitamins. And to me, it's like, that's a red sign, if anyone who's watching this was like, don't want to do that. Yeah. Because number one, I know you're going to get a low dose. Number two, it's unlikely that you're keeping your prenatal in the fridge. And then how long it's like, you can't extract where that fish oil is coming from, what's the, there's certain things that we just need to keep separate. And that, I would say, is one of them.
Yeah. What are some of the other nutrients that women particularly tend to need more of during, trying to get pregnant, and importance for raising a healthy baby?
Yeah, I think protein is really under, if I go back to the micronutrient analysis, like if I test the amino acids, you can see different types of amino acids that are missing for women. So like if you have a lot of digestive issues, L-glutamine is going to be way off. Usually if you're seeing a lot of stress, serine is going to be off, and that kind of heightens that anxiety and an ability to sleep. And just feeling like things are not right, if you will. So protein is under, like, women need that 30 to 40 grams of protein per meal. And ideally, like, it depends on if you're exercising or not and what your goals are, but like you should be hitting that minimum 100 grams a day. And I think
I would say most women are not getting that, or even close to that.
Yeah. If you actually track your food, like use MyFitnessPal and write in what you're eating. I have a lot of people, even like my marketing manager was like, I'm eating so well and blah. And I'm like, show me your breakfast. And as soon as she shows me her breakfast, it's like, that's 7 grams of protein. Like you have 1 egg, you have a bagel, and you have some whatever fruit on there, and it's just like, that's considered a healthy. And then it's like, punch that in and understand that you need to make that 30 grams. It's like, oh, so even 2 eggs is not enough. Yeah, even 2 eggs at breakfast is not enough. And so that if you think that you have enough protein and you think you've tried everything, like just go ahead and punch your food in for 3 days, and you're going to learn so much about what's happening in your system, because I can tell by just the way that the body looks, as I'm sure you can, like how the person is feeding themselves, how they're taking care of themselves, what they're taking, what they're doing. And so it's like if you're not getting enough protein, you need that for literally everything in the system. But like your hormones, we're talking about FSH and LH, they're amino acid hormones. We have, fat-based hormones. So those are all steroid hormones. Vitamin D is needed for that. Omega-3s are needed for that. Then we have the amino acid hormones. They're peptide chains that's your FSH and your LH. So your system literally like cannot function without protein. And then talking about building a new human, like guess what it's built out of? The things that you eat and your tissue. And so if you're tired and exhausted and your nutrients are depleted, the body has nothing to draw from. And so it just can't do it. And so we have to, I say that we as women create from a place of abundance and vitality. It's like that energy needs to be overflowing, like it has nowhere else to go but to make a baby. It's like, how many women listening to this right now feel like that?
You know, a
2%.
nutrient that's come up on a radar screen for me, and I've seen it on some of the micronutrient tests with women trying to get pregnant or even who are pregnant being low. And at least one company has started adding like 500 milligrams to their prenatal is L-Carnitine. There's actually quite a bit of interesting research on its importance for fertility. And
yeah, I don't see it a lot low on my stock, but I do know about it. Of course, it's the same as like CoQ10. I think it just depends on like who comes through but L-Carnitine is huge. I see it a lot in weight, of course, weight loss, but L-Carnitine is important for mitochondria, right? And so mitochondria is the essence of our fertility. It is that like everyone is doing research on it in terms of aging, anti-aging. If you have good functioning mitochondria, you're set because the mitochondria does so many things for us, but it's a very important nutrient. I would agree with that.
What are some of the micronutrient deficiencies that tend to come up among men?
Yeah. So for men, it's going to depend on what's kind of their picture, but for fertility sake, if you will, so like stress is a big one. And then stress impacts testosterone levels. And so then you're looking at, is it digestion that's preventing you from absorbing all those nutrients? Do you have pathogens that's taking that up? So in males, we'll see actually very similarly, like selenium, zinc, vitamin A, vitamin D, vitamin K, if their digestion is off. But now it's playing a different role for them, meaning that it's not so much the thyroid, but production of usually you need all those nutrients for production of good, strong sperm. And then with the immune system connection, if there's a lot of environmental toxins, then, or even pathogens, right? Like gut pathogens, then that's all those nutrients are going towards dealing with that instead of making good sperm. I'll see amino acid deficiencies as well. And cysteine is a big one. So an acetylcysteine, that's, really important antioxidant, really important for fertility as well. And so it's funny, right? Like the nutrients that we as females need are the same, very similar to the nutrients that the males need as well. They just kind of play different roles within the body. And then L-glutamine, if there is a lot of digestive, and I'll see glutathione low, and glutathione is the really strong antioxidant. And I find typically that's because males are not as, even when couples say, oh, we basically eat the same thing, but the female just adds a little extra microgreens on her salad, or she throws a little extra hemp seed or some other antioxidant powder into her smoothie that the male just doesn't tend to do unless the female is making it for him, But those little things add up. Like the females will get the salads at the restaurant where the males are more likely to go, right? And I know that I'm making some like general statements here because obviously it's not true for everyone. But what I see is that glutathione will be on the low side because males are more likely to drink a little bit more. They're more likely to, maybe stay up a little bit later, not make those little choices of like, I speak from my experience, like my husband is not the one who's like, I should sprinkle some microgreens on this. I'm like, put this on there.
So you mentioned toxins, and we've heard a lot about estrogenic substances in the environment that are common in BPA and phthalates and pesticides, et cetera. What type of toxin testing do you like to do? And then what are some of the typical detox strategies you like to incorporate?
Yeah, this is a big topic. And honestly, like that is The 99% of my practice is getting people cleaning up their environment and helping them clean out their system so their body can work the way that it's designed. I use Cellcore products. I don't know if you've heard of Cellcore, but they're really big in the detox space and have made some, groundbreaking products that have been very, defining for my practice and my patients and myself. But I use the Vibrant America Total Toxin Burden Test because I get the heavy metals, I get all the environmental toxins, so the plastics, the phthalates, the parabens, the volatile organic compounds. They actually just released a test where you can test the PFAs, so the kind of the forever chemicals as well, to see how much your system is excreting. And I'll look at organic acids, which is just like how your cells are metabolizing things, right? Nutrients, fatty acids, carbohydrates, and then like bacteria, yeast, that fungus, we can see that. Because the belief here is that the toxicity is actually the thing that's causing the nutrient deficiency. I've come from a place where I've supplemented a lot and nothing shifted. And so the idea that if you have to throw a bunch of supplements at your body just to barely function doesn't add up. So I use the bathtub analogy a lot, like with a shower head, and then you're the goldfish swimming in that bathtub. The water coming in, the cleanliness of that water is going to be really important. And so that's you figuring out what's in your environment that needs to be tidied up. Is it the lotions and the potions that you're putting on your face? Is it the quality of the water that you're drinking? Do you have a good reverse osmosis or distilled water, or are you still drinking Brita and bottled water? What is the quality of the food that you're eating? How much of it is organic or locally grown, or you grew yourself versus processed versus conventionally grown and heavily sprayed with pesticides? Because we can look at all those things, right? And we can test all those things. And then, of course, any past exposures. Like I have patients who grew up with parents who smoked in the house. And unfortunately, some of those heavy metals like cadmium and mercury and like they're still very much present and persistent in the system because it takes a long time for the body. The body tries to protect you. And so it stores it in the fat. And so those are the same women who have a hard time losing weight. They have painful periods. They have endometriosis, adenomyosis, because they've had this really heavy toxic load. And the body has just not been able to process it. So yeah, we're going to clean up the environment. That's the shower head. But now let's look at the drain and let's look at the sewer. Because if you put clean water in, that's fantastic. But what about all the grime that's still left on the sides? What about the murky water? You need to open up that drainage. So you need to make sure that that liver is working, that gut is working well, right? You're sweating on a regular basis. And then once that drainage in the sewer is working well, then we're going to get in there and we're going to scrub. And we're going to scrub the sides. And so you're not going to start with a heavy metal detox. You're not going to start. You just need to open up that drainage first and make sure the body has enough energy to even detox. And then once you're having 2 or 3 bowel movements a day and they're really full and you're eating enough veggies and you're sleeping well and for some people that takes months, for some people it takes years. So I always say, I don't care if you're slow cooker or microwave. You want to move in the right direction. It doesn't matter the speed, but move in the right direction. But don't start scrubbing before you do the other things because it's wasted effort, right? We don't want to wasted effort. Let's be strategic because we all have limited amount of time. That's our most precious resource. So clean up the environment, open up that drainage, make sure that sewer is not clogged and nothing is coming back up. And then we scrub so that water is clean and that fish can be happy.
Cool. Let's hit one more topic. Let's hit thyroid and then we'll wrap and you can give us your contact info. Thyroid is super important for fertility, for being able to get pregnant. There's been a lot of focus on it. So give us your take on thyroid, what tests you like to run, what interventions do you recommend?
So I'll say that thyroid is never the only thing. It's never just I find it's rarely the culprit. I find that it is impacted, but it's not the root cause. And so it works in conjunction with stress, with the adrenals and the ovaries. It's a whole hormone picture. But most people, first of all, do not get the proper thyroid panel. So you test your TSH and you're told that it's fine. Your TSH just tells us how well the brain is communicating to the thyroid. It doesn't actually tell us how much thyroid hormone your body has. And so that's not a complete test. So you need to have a TSH, but you also should do free T3 and free T4. And then you should probably run some antibodies to see if there is an autoimmune condition that's present within the thyroid, because autoimmune conditions are going to put you at a much higher risk for miscarriages. And they go unnoticed, undiagnosed all the time. And then, even things like reverse T3, I don't want to say that necessary, but it's good to look at it, right? Like I'll run all that stuff. A lot of docs will just run the free T3 and free T4 and the TSH, and it won't look at the antibodies. But thyroid is like it's your metabolism hormone. It turns everything on. It's so important for being able to conceive, but also to be able to maintain the pregnancy. And that's something that should be checked. Like, again, I have so many patients who have to fight to get these tests, which is insane to me, that, hey, your TSH is high, you're pregnant, you should be like, we need to address this right away, as opposed to, oh, it's okay, it doesn't matter. So I find that a lot of people will focus on thyroid if they have weight issues, especially because everyone's educated themselves. If I have poor thyroid function, I'm going to struggle to lose weight. But in reality, usually there's a bigger component. Usually the liver is involved. Usually there's some sort of inflammation. For some people, the immune system is going to be involved. And so you want to look at the gut, thyroid, the stress, the inflammation, and look at it as a whole picture instead of just these kind of single. When I see the thyroid is off, I just know that something is off, but we don't understand why. So let's dig deeper.
So let's say you get a patient, and I'm not sure what figure you like to see as far as TSH, if it's 1.5 or 2 or 2.5.
1 to 2. 1 to 2 is where I'd like to see.
1 to 2. Yeah. Okay. So let's say you get a patient who has slightly elevated TSH, like 2.5, 3, and then their free T3 and their free T4 are like in the low end of normal. Maybe there's no antibodies. What would you do? Would you send them back to their primary care doctor to get Synthroid, or what would you do?
Yeah, that's a great question. So no, usually when it's just you're starting to see it low, like this is where natural medicine really, like this is our jam, right? We just start to see that the thyroid is sluggish. The next thing I'm going to look at is, well, why is that low? So if both free T3 and free T4 are low, it's likely that you don't have enough nutrients to make those hormones. And whether it's amino acids, whether it's that vitamin C, selenium, zinc, vitamin A we talked about, or iodine, or then the communication between the brain and the thyroid, because everything is a negative feedback loop. So you're just going to look at, okay, if both of them are low versus we make mostly T4 and then it's converted into T3 in the liver. If you're making lots of T4, but that T3 is really low, chances are that liver is sluggish. And so that conversion isn't happening, and so you can start to kind of get an idea of what's going on, but this is where some more testing. Like if I look at micronutrients and all your thyroid hormones are low, hey, guess what? You probably just don't have enough of the actual nutrients. So yeah, we want to boost that. But then the next question is, well, why are those things low? Oh, let's look at the gut. Okay, you're not absorbing. You have these pathogens. Okay, so let's fix the gut. And then why do we have all these pathogens? And why is the liver overburdened? Let's look at the environmental toxins. So I say there's the test that shows what's happening and test that shows why it's happening. We want to know the what because it helps us get quick wins. Like I want you to feel better now so you can keep going. But if we don't address the why, you're going to be stuck in the what all the time, right? You're going to be now dependent on those supplements. So that's kind of my approach is that, okay, this is good. We want to keep an eye on this, but let's go deeper. Let's go a little bit deeper.
And that, of course, is the true magic of the functional medicine approach and what really looking at root causes is. And
100%. Yeah. And I have a lot of people come to me who've come to practitioners said, well, they never looked at this. And so if there's practitioners listening to this, I encourage you to dive deeper. I know that some of your patients don't want to do it. I have a ton of patients who I don't accept because they don't want to do it. They're just like, oh, I want help, but not really. So it's okay. What I hope is recognized for those patients that know that you don't really want the help. And that's okay if you're okay with that. But if you want the help, this is the work. And there's people who want to do the work. And I think it's our job as practitioners to really show people that, like, this is what's possible. And here's some general advice that's really great. But if you want to take it to that next level and actually heal your endometriosis or your PCOS instead of just manage it, then it's not going to be just take CoQ10 and inositol and whatever and hope that it works. It's going to be doing some much deeper work, the scrubbing, getting the gloves out and doing the scrubbing.
That's great. Good. So how can people get a hold of you? What's the best contact information?
Sure. Honestly, the best place to contact me is going to be through my Instagram. I'm on there really active. I go on stories. I share lots of valuable content. I have my own podcast as well, Modern Health with Dr. Jane, but at Dr. Jane Levesque, and lots of resources on the Instagram. You can send me a DM and say hello. And then, I have the resources for the website.
Can you spell your name for the listeners?
Yeah. So Dr. DRJANE and then LEVESQUE.
That's great. Thank you so much.
Thanks so much for having me, Ben. It was a pleasure.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would certainly appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. That way, more people will discover the Rational Wellness Podcast. And I wanted to let everybody know that I do have some openings for new patients, so I can see you for a functional medicine consultation for specific health issues like gut problems, autoimmune diseases, cardiometabolic conditions, or for an executive health screen, and to help you promote longevity and take a deeper dive into some of those factors that can lead to chronic diseases along the way. And that usually means we're going to do some more detailed lab work, stool testing, sometimes urine testing, and we're going to look at a lot more details to get a better picture of your overall health from a preventative functional medicine perspective. So if you're interested, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a new consultation for functional medicine. I'll talk to everybody next week.